Welcome to the Global News podcast from the BBC. I'm Janat Jalil and I'm joined by our correspondent Anne Soy, who's been on the front line in the fight against Ebola in the Democratic Republic of Congo. And Anne, tell us what you've seen.
I have been to the epicenter of this outbreak of Ebola, which so far is the third largest in history on record. And that is Bunia in the northeast province of Ituri. And then there are two other towns, Rwampara, which is about 15-20 minutes drive from Bunia, and Mongbualo, which is quite remote, surrounded by a forest. It's a mining town without tarmac, no paved roads. And it is believed that this is where the outbreak started, but the response teams, scientists are still trying to trace the first patient 0, to try and figure out where this started. So I have been to those three hotspots, and what I saw is a community in shock, just coming to terms with this outbreak that was simmering for weeks, if not months, before they discovered it. And when they discovered it, families had lost their loved ones. I spoke to a man at the cemetery in Bunia who said that he buried his mother the day before. He had come back to bury, or rather he buried his father the day before. He had come back to bury his mother. He had already lost 3 sisters, and 2 more sisters were in hospital with Ebola, and he was just devastated. And throughout that interview, he kept saying, Ebola is real. People need to know that Ebola is real. He was really shaken, and that is because at the beginning of this outbreak, there was a lot of resistance from parts of the community. Some were not believing the message of Ebola. There were myths about how it came about. Some thought it was poisoning, others thought it was witchcraft, and that is what helped it to spread.
So there are all kinds of questions we need to unpack here. First of all, why are people so suspicious? What's the background to this?
We were told of a story about this young man who died in the capital, Bunia, and his family transported his body in a coffin to Mongbualo, that remote mining town without paved roads. And the road is very bumpy. And I saw the lorries that people use in convoys to travel there, convoys because of insecurity. And because of the bumpy road and its people and luggage in lorries, the coffin broke. And when the coffin broke, they just took his body and buried it, and then they burned that coffin. It is thought that this was one of the first mass infection events, because after that funeral, many of the people who attended the funeral caught Ebola and died. And people then came up with this rumor that it is the coffin curse. The ancestors were not happy because they burned the coffin, and that they had come back to punish them for burning that coffin. And so they were using stories like these to explain it away while Ebola was spreading. Ebola is most infectious when a person who has contracted it has died. And funerals in this part of the world involve a lot of contact, washing of the body as a show of love to the departed. They're escorting them on a journey to the next life. And so people come and touch the body as they are mourning, to wash that body communally. And that is exactly how Ebola spreads.
And Anne, historically, that there has been suspicion of aid organisations, medical professionals that come in from outside Africa. But you, while you were in the epicentre of this outbreak, met a patient who got Ebola but then fully recovered. And he had a message that he wanted to send out to other people who might be caught up by this.
He did. That was Daniel Kalambata. And he was so happy to recover from Ebola. And when he came out, I asked him how he was feeling. And he said that he was very happy and relieved that he had recovered. The hospital director told me that he was also happy. One, because it was such a morale boost for his staff. They had lost 5 medics in that hospital. And then 2, because once he goes back to his community, people can see that when they come to the Ebola treatment centers, they can recover, they can get cured and go back to their community. One of the rumors that had been circulating previously, because partly based on fact, when people came to the Ebola treatment units, many of them died. And this was only the second person in that community to recover. So it was changing that narrative. And that is why it is so important. And the healthcare workers came out escorting him with song and dance because of that.
That is really a great story to hear amid all this pain and suffering. And the medical professionals treating these patients are also taking other measures to try to inspire confidence. For instance, having glass windows in isolation units so relatives can see what's happening.
That's right. This glass window that you're talking about is in one of the Ebola treatment units. They have over time tried to modify how they care for patients of Ebola to keep healthcare workers safe, because usually they are the group that is most at risk, because they are in contact with the patients, they are touching the patients' fluids, and those are the agents of infection. So they have created these wards that are, typical wards. But then on the outside, they have large windows, like the glass window that you have in banks, where tellers sit behind a desk and you talk to them through some glass. So something like that. So families can come and visit them and see them and talk to them. So they're humanizing the patients. Previously, it was not possible to do that because the patients needed to be under isolation. They are infectious, and they did not think it was safe for families to come and see them. And that made it very difficult for families to process all this. Once their patients went to hospital, they never got to see them. And if they did not make it, they even did not get to see the bodies to confirm that their relatives have died. And that made it very difficult during previous outbreaks.
And as you say, it took weeks, possibly even months before this latest Ebola outbreak was detected. Why did it take so long? Is it partly down to the Trump administration's severe cuts of international aid?
American funding has played a big role for decades across the African continent, supporting healthcare, supporting a response to outbreaks of disease, supporting epidemics. For example, HIV and AIDS, for a long time, USAID was supporting that in a very big way. I reported that earlier in my career. I was reporting on HIV for 7 years, and I saw the difference antiretroviral treatment brought, even to alleviate stigma, because in my country, Kenya, it was called SLIM, because people just became more and more emaciated, and then they died because there was no medication. But when the treatment was discovered and funded by American money, it gave people a dose of life. And people living with HIV became productive. They could take care of their families. So it had made a huge difference in the community. And when it was suddenly cut, you can imagine the impact that it has had on communities across the continent. And so in a big way, the thinking now is that if it had continued, the systems would have been in a better position to detect this early. The surveillance would have been able to pick it up earlier, and they would have managed to control it. This is a country, the Democratic Republic of Congo, that has dealt with, this is the 17th outbreak of Ebola. They have the experience, they have the know-how, they know how to deal with it. But also, it is a country where people are very poor, and that makes it very challenging.
And there is armed conflict. It's also a vast country. And we've now got this warning from the Red Cross that this Ebola outbreak may not have even peaked yet, and it could last for a year.
That's right. Experts believe that they are behind the curve. So what they mean is that the worst is yet to come. But also, in a typical outbreak, usually when the testing picks up, then more and more people are discovered to have the disease. So the numbers will go up, but it isn't necessarily a bad thing, because it means that many more infections are being detected and can be taken care of. People can be referred for treatment rather than continuing to spread it in the community. So that is what the healthcare workers are saying, that for the next few weeks, the numbers will continue to rise before they get to a point where they feel that the response is catching up and is bringing this under control.
And Anne, there have been a few cases outside Congo, a question that a lot of people are asking is, could Ebola cause the next pandemic?
The outbreak has been detected in the capital of neighboring Uganda. Many of those cases having come from the epicenter here in the Democratic Republic of Congo, in the northeast province of Ituri, which borders Uganda. And that's because when people were falling ill and they were not getting the care that they needed in their country, then they went to the next best place, which was Kampala. But that seems to be under control, the outbreak in Ebola, which really speaks to the ability of countries to bring this under control when they catch it very early on. The World Health Organization says that the neighboring countries, that is Uganda, the countries that surround the Democratic Republic of Congo, including South Sudan, because it borders Ituri province, the epicenter, are at high risk of getting cases. But then the countries beyond the region, the risk of infection is low.
Anne, thank you. That was Anne Soy. And if you'd like to hear more from the Global News podcast, please click on the link below.